has a double lumen.
Okay, so this is
So
your patient.
your Levine tube doesn't have it. It's just a straight forward tube without the side bit. And that's what you're going to use most of the time is Levine. Is this video or camera?
Do this and leave this in something.
Okay, so you're going to gather your equipment. So you have your tube and your packaging. And these are 14, 16, 18 French sizes. And your doctor will order the size, 14, 16, 18. So you just go pick the size off the shelf that he wrote in his order. And then you gather, you need a 60 cc. This is a piston syringe.
Okay, we want to set our dose. So our dose would be how many milliliters per hour. And then our total volume would be how many
big barrel, 60 cc.
milliliters are going to go in
ounce
the
capacity.
designated period of time, like say 4 hours.
You have your gloves.
So you can set
you
either
have your
one
KY
first.
jelly.
It doesn't matter which one you set
get
first.
a towel.
The total volume or the
So you put something on the patient
milliliters
so
per
you're not
hour.
splashing anything on.
So you can press
Then you're going
those,
to confirm your orders again.
right now it's set on
Sure everything's
30.
correct.
So if you
Come
want
in
it
here
on
and
20,
you're going to check the armband because if this is an older patient, you
25,
say
say
you're
we want
Mr.
25.
Smith, they'll say
See,
yeah.
this person down
If you say,
there.
are you Mr.
You
Gonzalez?
let it
Yeah.
come to
Well, are
rest,
you
and
Mr.
then you
Jones?
push the
Yeah.
volume.
They'll say yeah,
Okay.
just about
It was
anything.
previously set
So
on,
you need to check the armband. Don't just ask them and they say yeah, you go. You got to check the armband. The other thing that happens commonly is when you're in a room where there's 2 or 3 or 4 beds, they get in the wrong bed by mistake. Now if you're thinking, okay, the patient in the A bed, well, this may be the right patient, maybe not, because they switch beds and don't realize they've done it. And if you don't know what they look like, you might think it's the right patient, so you've got to always check the armband. So you check the armband, yeah, this is your patient, this is the one you want. Then you're going to explain to him, you're going to have to set him up. Set him up and explain to him, doctors ordered an NG tube, and we're going to put it to suction to help keep your stomach empty. After surgery, we're going to put it in now to get you ready. Explain to him, what you're going to do, why you're going to do it now. Do you have any questions about it? Okay, are you ready? We'll do it now if it's okay with you? Okay. So you get them in a setting position. Then you're going to take your towel or drape, put it over them. And then you've got your supplies here on your overbed table. So you would put your gloves on. I'm not going to put them on because they're loaded with powder. I just get tired of being on my hands. So you put your gloves on. You're going to open your packages. Remember, this is a clean procedure. It's not sterile. It's just clean. You'd have a roll of tape. You'd have your safety pin. You have your gloves. Your piston syringe. You're going to open your packaging for your Levine tube. And you're going to take into account. You need to measure the distance of the tube you now need to use. So I need to see your chest here and your xiphoid process here. So you go, remember, from the edge of the nose, tip of the nose to the ear, and then from the tip of the ear. What? Just come in closer. Come in closer. So you're measuring from the tip of the nose to the tip of the ear. Hold it there, and the tip of the ear to the xiphoid process, which remember in CPR, that is the breastbone. It would be right about here. Tip of the xiphoid process. You're going to go from tip of nose to tip of ear to the xiphoid process. Okay, so about that length. That's how much you need to have down to get into the stomach. So then you're going to take your tape and you're going to mark that.
Because the GI tract is not sterile.
This tubing you'll see doesn't have any graduated markings. Some of them have centimeters, so you know you can read on a centimeter like that, you know by that. But this one doesn't have it. A lot of them don't, so you just use your tape to mark your spot. Okay, then you're going to have it. This patient is coherent, able to talk to you, able to swallow fluids. You're going to give them their little glass of water with a straw. Now, some facilities, you have them swallow, or some facilities, no water, they just swallow. So you have to follow you're going to run one way your textbook. Wherever you work, you have to check your facility because there's variances in policy and procedure, and you do not want to veer from your policy and procedure. So whatever your policy and procedure is in your facility where you work, that's what you go by, not your text. You go by your facility policy.